Today I've just got a quick video for you guys about how to treat hot flashes in perimenopausal women. As we all know, probably as women approach menopause and they begin to lose estrogen, they experience a variety of physical and emotional symptoms, and these vary in intensity and degree, but almost all women experience hot flashes. And hot flashes are an example of temperature dysregulation. A woman is comfortable and suddenly she experiences profuse sweating. It's intense, it's out of the blue, the temperature hasn't changed, and the other people in the room are comfortable. They're not complaining. It can really soak a person. A person can get soaked. When they happen at night, they're called night sweats, and they can soak the sheets. So there's one way to treat menopause by replacing the estrogen that is depleting, and that's called estrogen replacement therapy. But that term has since changed because we're recognizing that it's normal for a woman in her late 40s, early 50s to have declining estrogen levels. So you're really not replacing anything that's supposed to be there. But nonetheless, that is the pathophysiologic mechanism. That it's basically a protracted estrogen withdrawal that causes everything from temperature dysregulation to emotional dysregulation, depression, anxiety syndromes, to loss of bone density and other things. It is not without its risks, replacing estrogen, because that's absolutely known to be procarcinogenic. And so, for example, in women who have not had a hysterectomy, who still have a uterus, they're at increased risk for uterine cancer and similarly breast cancer, particularly if there's a positive family history. But you really can't give unopposed estrogen. And so it becomes complicated. And even if you combine it with progesterone and you're monitoring it appropriately, this is beyond my pay grade. I'm not a gynecologist, but there is always a risk of cancer. And the withdrawal from estrogen is not life-threatening. Certainly, bone density, osteoporosis can lead to fractures, and that can be dangerous. But what I want to talk about is a quick and easy treatment for hot flashes that does not involve prescribing hormones, exogenous steroid compounds that can cause some pretty serious side effects. And that is low dose of an SSRI. In particular, Effexor, venlafaxine, which is actually an SNRI, serotonin norepinephrine reuptake inhibitor, but at very low doses, at the starting doses, it has predominantly SSRI, selective serotonin reuptake inhibition actions only. So at the very low doses, 37.5 milligrams and 75 milligrams, it's an SSRI. The norepinephrine reuptake inhibition doesn't kick in significantly until you get to a higher dose. And just that very low dose, or low dose of any other SSRI, is very effective at blocking the hot flashes that women experience when they go through menopause due to estrogen withdrawal. And it's very interesting because it's a paradoxical reaction. It's a side effect of these medications. And yet when it's given to an individual who's already experiencing temperature dysregulation and their brain is already getting confused because of the change in the hormonal environment, and so these paroxysms of sweating are coming upon the woman, and it's uncomfortable, it's embarrassing for some women. It's just an inconvenience, but it can be stopped by a very low dose, and it's very effective. I can only give anecdotal information, but it's very safe, and it's been a home run for me every time. Now, granted, I'm a psychiatrist, so in my practice, a lot of times what I was doing was switching women who were already on a low dose of an antidepressant, maintenance antidepressant, who were doing fine with their mood, but who complained of this side effect, or perhaps their mood wasn't optimal. I can think of at least one case in which we were already contemplating a change in antidepressant and adding something, increasing another neurotransmitter other than simply serotonin, but they were also having hot flashes due to menopause. And in each case, switching from Zoloft, for example, or Prozac to venlafaxine Effexor, it was a home run. They came back in a better mood, with sleeping better, with no hot flashes, and within a couple of weeks, within a few weeks, I'll say. So it's definitely something to ask your doctor about. Gynecologists know about this. It's in widespread use. But if your primary care physician is treating you, or if you just happen to be seeing a psychiatrist and you're not mentioning your menopause, your physical symptoms of menopause to that provider, this is a pearl, a nice pearl to know, and it's very safe. It's very well tolerated. Venlafaxine is the worst one, and particularly at night sweats, and it's notorious for it, but it does a really good job. And while it does have to be tapered once we're done, the dose needs to be lowered slowly so that there's no physical withdrawal. Some people report just a really hard time coming off of these medications, SSRIs and SNRIs. I've never had trouble. I think if you just lower the dose and lower the dose and then take the lowest pill and take fractions of that dose and just slowly over a period of weeks, there's really, I've not had difficulty in weaning somebody. You hear these horror stories. It took years to get me off of Effexor. And really, it should not, because even if you don't taper it, even if you cold turkey and the person goes into a severe physical discontinuation syndrome, it only lasts a few days. I mean, it's terribly uncomfortable, but it's not dangerous. It only lasts a few days. So I don't understand these reports of, oh, it took me forever, years to come off Prozac. You're going too slowly. There's no need to be afraid of the withdrawal because there was a bad reaction initially when the dose plummeted, when a person dropped the dosage too quickly. A lot of times I think that's what happens. Providers lower the dose too aggressively, or the patient stops taking the medication, just decides to stop taking it, has a terrible time, and then we try the titration, and at every little increment that we decrease, the signs of the withdrawal come back, and there's a panic sort of sets in, and anxiety exacerbates what really doesn't have to be that difficult an experience. But at any rate, venlafaxine, 37.5 to 75 milligrams of Effexor XR for your postmenopausal women that are having hot flashes.